Hi, I'm Dr. Mike McInnes, and I'm one of the chief educators here at Doctors in Training. I want to welcome you to this lecture on the muscles and nerves of the pelvis. So here's Dr. John Phelan.
Two bilateral muscles, the piriformis and the obturator internus, are found on the inner walls of the bony pelvis. The piriformis, named for its pear shape, originates from the ventral surface of the sacrum just lateral to the 2nd through 4th ventral sacral foramina. During its inferolateral course, it passes superior to the ischial spine and leaves the pelvis through the greater sciatic foramen. It fills most of this foramen and thus contributes to the posterolateral wall of the pelvis. The piriformis traverses the gluteal region and inserts on the femur. It is a lateral rotator of the hip joint and will be discussed further during the solid anatomy lecture on the gluteal region. The obturator internus obturates, or obstructs, the obturator foramen. It takes its origin from the parts of the ischium and pubis forming the periphery of the obturator foramen, as well as from the obturator membrane, which fills and thereby also obturates the obturator foramen. The obturator internus leaves the pelvis through the lesser sciatic foramen and traverses the deep gluteal region to reach its insertion point on the femur. The third structure obturating the obturator foramen is the obturator externus, which essentially mirrors the obturator internus on the external surface of the hip bone. Both the obturator externus and internus are lateral rotators of the hip joint and will be discussed further in the solid anatomy lecture on the gluteal region. The obturator canal, not to be confused with the obturator foramen, is a pathway through the superior aspect of the obturator foramen that penetrates the obturator internus, the obturator membrane, and the obturator externus. The obturator canal allows the obturator neurovascular bundle to pass between the true pelvis and the medial thigh. The inferior pelvic aperture is filled by the pelvic diaphragm, which separates the true pelvis from the perineum inferiorly. This funnel-shaped group of muscles supports the pelvic viscera and allows transmission of the vagina, urethra, and rectum between the pelvis and the perineum. The pelvic diaphragm is composed of the levator ani and the coccygeus. The coccygeus takes its origin from the ischial spine and inserts on the coccyx. It lies on the anterior surface of the sacrospinous ligament, which prevents this ligament from being visualized within the pelvis. The coccygeus is innervated by branches from the sacral ventral rami, usually S3 and S4. The levator ani is a group of 3 bilateral muscles, the iliococcygeus, the pubococcygeus, and the puborectalis, which are difficult to distinguish on gross inspection. The levator ani overlaps the obturator internus and takes part of its origin from a thickened band of the fascia of the obturator internus, which is conveniently named the tendinous arch of the levator ani. It runs from the pubic symphysis to the ischial spine. Several different fascias actually contribute to the tendinous arch of the levator ani, but usually only the obturator internus fascia is credited for the sake of simplicity. Based on its name, one might imagine that the iliococcygeus attaches to the ilium, but it does not. In lower mammals, where it was first named, it does. It originates from the ischial spine and the tendinous arch of the levator ani and inserts on the coccyx and the anococcygeal ligament, which extends from the tip of the coccyx anteriorly along the midline to the anal canal. The pubococcygeus originates on the superior pubic ramus and tendinous arch of the levator ani and inserts on the coccyx and the anococcygeal ligament. The left and right puborectalis muscles originate on the posterior aspect of the body of the pubis, lateral to the pubic symphysis, and pass along the lateral sides of the rectum, uniting in the midline posterior to the rectum to form a sling around the rectum. When this muscle is activated, it pulls the rectum anteriorly, producing a flexure which assists in resisting defecation. The gap in the anterior part of the levator ani is the urogenital hiatus. The urethra and the dorsal vein of the penis pass through it in males, and the vagina, the urethra, and the dorsal vein of the clitoris pass through it in females. Since the levator ani forms part of the border between the true pelvis and the perineum, and it overlaps the obturator internus, the portion of the obturator internus superior to the levator ani is in the true pelvis, while the portion inferior to it is in the perineum. On the medial surface of the portion of the obturator internus that is in the perineum, there is a gap in the fascia of the obturator internus called the pudendal canal, or Alcock's canal. This canal transmits the pudendal neurovascular bundle, which will be described in a moment. The levator ani is innervated by branches of the pudendal nerve and by branches of the third and fourth sacral ventral rami, which are sometimes referred to as the levator ani nerve or nerves. The nerve supply to the pelvis is from the ventral rami of the lumbar and sacral spinal nerves. Remember that the dorsal rami are only involved in sensory innervation of skin on the back and in motor innervation of muscles acting on the axial skeleton. The pelvis is considered to be a part of the appendicular skeleton, so all of the muscles associated with it are innervated by the ventral rami. Also, be aware that many of the nerves found in the pelvis are actually involved in innervation of the lower extremity and do not innervate any pelvic structures. Innervation to the pelvic viscera is provided by autonomic nervous plexuses that will be described shortly. If you've watched any of the solid anatomy lectures on the abdomen, you may recall that the ventral rami of L1 to L4 combine to form the lumbar plexus. The only branch of this plexus that crosses the pelvic brim to enter the true pelvis is the obturator nerve, which carries contributions from the ventral rami of L2, 3, and 4. It does not innervate the obturator internus muscle, but it passes through the obturator canal with the obturator artery and vein and innervates the obturator externus muscle. The obturator nerve continues into the medial thigh where it innervates muscles and skin. Part of the ventral ramus of L4 does not join the lumbar plexus, but instead combines with the ventral ramus of L5 to form the lumbosacral trunk. This trunk crosses the pelvic brim and travels medially to combine with the ventral rami of S1, 2, 3, and 4, forming the sacral plexus. Occasionally, this plexus is referred to as the lumbosacral plexus. It lies on the anterior surface of the piriformis muscle, and most of its branches leave the pelvis via the greater sciatic foramen. One exception is the motor nerve to the piriformis muscle, which is conveniently named the nerve to the piriformis. The branch of the sacral plexus that covers the most territory in the pelvis is the pudendal nerve. Receiving contributions from S2, 3, and 4, it branches from the sacral plexus and leaves the pelvis through the greater sciatic foramen. It enters the gluteal region, but does not give off any branches there. It passes between the sacrospinous and sacrotuberous ligaments, then leaves the gluteal region through the lesser sciatic foramen to get to the perineum. The pudendal nerve immediately enters the pudendal canal and travels anteriorly. Within the canal, it gives off the inferior rectal nerve, which leaves the canal by passing through the fascia of the obturator internus and heads medially to the external anal sphincter. The inferior rectal nerve provides motor innervation to this muscle and to part of the levator ani, and provides sensory innervation to the inferior part of the anal canal and to skin around the anus. The remainder of the pudendal nerve bifurcates into its terminal branches, the perineal nerve and the dorsal nerve of the penis or clitoris, at the anterior end of the pudendal canal. Motor branches of the perineal nerve innervate part of the levator ani and all of the muscles of the urogenital triangle, which will be described in the solid anatomy lecture on the perineum and external genitalia. The perineal nerve also gives off posterior scrotal or labial branches that innervate skin covering the scrotum and the labia. The dorsal nerve of the penis or clitoris travels superiorly along the medial edge of the ischiopubic ramus to reach its target genital organ, to which it supplies sensory innervation.
All right, it's time for a quick clinical correlation. Let's say you're delivering a baby and the mother wanted to try natural childbirth, but now that she's in the middle of it, she says, you know what, this really hurts. I'm going to go ahead and have anesthesia after all. And say it's too late for spinal anesthesia or an epidural, the labor's too far along, the baby's already down in the perineum. What can you do? Well, you may opt to perform a pudendal nerve block. In Latin, the word pudenda means something you're ashamed of. So it's easy to remember that the pudendal nerve and its branches innervate the anogenital area, the skin around the anus, the clitoris and labia in women, and the penis and scrotum in men. So, if you can block the pudendal nerve, you can provide anesthesia to all these areas. You put 1 or 2 fingers into the vagina to make sure that the baby's head is protected from the needle. You palpate the ischial spine. That's an important landmark to remember, the ischial spine. And then you insert your needle and aim for that landmark. The idea is to inject the nerve where it crosses the sacrospinous ligament, which is right by the ischial spine. You want to inject the pudendal nerve before it bifurcates into its terminal branches so that you have anesthesia to all those branches. That's it for this clinical correlation. Let's get back to Dr. Phelan.
Moments ago, we mentioned that the obturator externus is innervated by the obturator nerve, a branch of the lumbar plexus. The obturator internus is innervated by the nerve to the obturator internus, which is a branch of the sacral plexus. It follows the same course as the pudendal nerve, but while in the gluteal region, it gives a motor branch to the superior gemellus muscle. Upon passing through the lesser sciatic foramen, it terminates by innervating the obturator internus in the perineum. The remaining branches of the sacral plexus, which are the superior and inferior gluteal nerves, the sciatic nerve, which is the largest nerve of the body, the posterior cutaneous nerve of the thigh, and the nerve to the quadratus femoris are not involved in innervating any structures in the pelvis and will be discussed during the solid anatomy lectures on the lower extremity. The S5 and coccygeal spinal nerves exit the sacral hiatus and divide into ventral and dorsal primary rami. The ventral rami pierce the sacrospinous ligament and the overlying coccygeus muscle to enter the inferior aspect of the pelvis. Here, they combine with each other and occasionally with part of the ventral ramus of S4 to form the coccygeal plexus, which sends cutaneous branches to skin over the coccyx. The source of autonomic innervation to the pelvis is the superior and inferior hypogastric plexuses. The superior hypogastric plexus, which lies atop the aorta at its bifurcation, is made up of sympathetics from spinal cord levels T10 to L2. This plexus does not send any direct branches to the pelvic viscera, but terminates as the left and right hypogastric nerves, which contribute to the inferior hypogastric plexus. The inferior hypogastric plexus, which is made up of sympathetic and parasympathetic nerves, is located on the anterior aspect of the sacrum. The sympathetics in this plexus come from the inferior hypogastric nerves and from the sacral sympathetic trunks. The sacral sympathetic trunks are very tiny, run on the ventral surface of the sacrum, and do not come from sacral levels of the spinal cord. Recall that the sympathetics arise from spinal cord levels T1 to L2. Thus, the sacral sympathetic trunks are just extensions of the lumbar sacral trunks. The parasympathetic contribution to the inferior hypogastric plexus comes from the pelvic splanchnic nerves, which arise from the second, third, and fourth sacral levels of the spinal cord and follow the ventral rami of the spinal nerves of these levels through the anterior sacral foramina to enter the pelvis. Recall that the parasympathetic nervous system is said to be craniosacral. If you watched the Solid Anatomy lecture on the cranial nerves, you may recall the cranial nerves 3, 7, 9, and 10 carry parasympathetics. They were the cranio part of that craniosacral label. The sacral part is the pelvic splanchnic nerves. Recall also that splanchnic refers to viscera, not sympathetic or parasympathetic innervation. For instance, recall from the Solid Anatomy lectures on the thorax and the abdomen that the greater, lesser, and least splanchnic nerves provided sympathetic innervation to the abdominal viscera. But the pelvic splanchnic nerves provide parasympathetic innervation to the pelvic viscera. The inferior hypogastric plexus and its innervation of the pelvic viscera will be detailed in the Solid Anatomy lecture on the pelvic viscera.
Now it's time for your end of session quiz. So I want you to pause the video, complete the end of session quiz questions in your study guide, then restart the video to go through those answers together. All right, let's go through the end of session quiz together. First question, what is the muscle that pulls the rectum anterior to resist defecation? This is the levator ani, and it's made up of the iliococcygeus, the pubococcygeus, and the puborectalis. Next, which structures travel through the lesser sciatic foramen? This is the obturator internus muscle, the pudendal nerve, and the internal pudendal artery. Next, through what structure does the pudendal canal, or Alcock's canal, tunnel? It tunnels through the fascia of the obturator internus muscle. Next, what structures are found in the pudendal canal? So we have the pudendal nerve, the internal pudendal vessels, and the dorsal nerve of the penis or the clitoris. Next, what are the two major nerves that the sacral plexus gives rise to? So the two major nerves are the pudendal nerve and the sciatic nerve. The complete list also includes the nerve to the obturator internus, the superior gluteal nerve, the inferior gluteal nerve, the posterior cutaneous nerve of the thigh, the nerve to the quadratus femoris, the nerve to the levator ani and the coccygeus, and the perforating cutaneous nerve. But the two big ones are the pudendal nerve and the sciatic nerve. Next, label the following structures. So here we see the piriformis muscle leaving the pelvis through the greater sciatic foramen to insert on the femur. We also see the coccygeus muscle and the levator ani muscle. Next, we have the piriformis muscle, the coccygeus muscle, levator ani muscle, the atal hiatus, and the urogenital hiatus. Next, in this one we're looking at the pelvic diaphragm from below. So you see the pudendal nerve, the inferior rectal nerve, and then the coccygeus muscle and the piriformis muscle. Next, we have the pudendal nerve, the dorsal nerve of the clitoris, and the posterior labial nerve. And the last one, on the top left, we have the lumbosacral trunk, and then on the right, the pelvic splanchnic nerves. And we see those two important branches of the sacral plexus, the sciatic nerve on the left and the pudendal nerve on the right. So that's the end of our end of session quiz, and that's the end of our lecture. I hope you learned something. Good luck studying.